Empowered to Serve Live Roundtable, a continued conversation focusing on community transformation through faith, finance, and business. Empowered to Serve is an American Heart Association initiative that accelerates changes in education, business, and communities to help overcome structural racism and achieve health justice. I'm Roland Martin, host of Roland Martin Unfiltered, and certainly pleased to be your host again for today's conversation. And we're here today because for far too long, structural racism has been a barrier, a significant barrier to health and prosperity. It has led to a massive national public health crisis, and it has taken a painful and unacceptable toll on the health and well-being of people of color in America. Now, before we go any further, we want as many folks watching this as possible. So we want to stop what you're doing and hit that share button, start a watch party, post it on all your social media platforms so you can get your friends and your family to watch us right here as well. So we're certainly ready to get started for a great conversation. With me today is Wes Moore and also Pamela Garmon Johnson. All right, first off, Pamela, just tell folks who you are.
Well, first of all, good morning, Roland. Hope you are well. Good morning, Wes. I'm Pamela Garmon Johnson. I serve as the National Vice President of Health Equity, Impact, and Partnerships. So what does that mean? I'm a dot connector. I love being able to connect organizations, individuals, institutions, so that we can scale projects to have the most transformative impact.
Wes?
Good morning. I'm Wes Moore. I'm an author. And I'm also the CEO of Robinhood, which is one of the largest poverty fighting organizations inside the country. And really with our core focus, it's being able to both understand not just poverty as you see it now, but also why do we have to even deal with it? What are the underlying issues? How does systemic racism and systemic inequalities actually flow into the fact that we have such a deep level of poverty within our society? And so I'm thrilled to be part of this conversation today, also with my frat brother, my soror as well.
We're certainly glad to have you here. That's why I represent. I was kind of like, Wes, I'm a little disappointed. Should have been rocking some kind of black and old gold, but okay.
I have all my lit and I have all my para all around me.
All right, cool. Just checking, just to make sure you representing properly. All right, then let's actually get right into this conversation. You mentioned the whole issue of poverty. You talked about and the role that really plays. John Hope Bryant, founder of Operation Hope, makes this comment all the time, and he said, "You've never seen a riot in a neighborhood with a credit score of 700 or higher."
Mm-hmm.
And when you start thinking about health disparities as well, I mean, there is a direct correlation to the issue of money, access to money, and when it comes to health outcomes. And they also run along essentially race.
Very much so. And you look at the fact that what we're looking at right now, these situations of the health disparities and the economic disparities, you're absolutely right. These things run completely alongside one another. The most predictable life indicator in this country is race. And it's across the lines. It's everything from income and wealth to health, mental and physical health, to education, to income, to maternal mortality. Right? Race is the key leading indicator across the board when you're looking at all those things. And so when you're looking at all those factors and the fact that in areas of very high poverty, infant mortality rate is 2 times higher, that young children who are living in poverty experience high rates of toxic stress, how that impacts their brain development, how it ultimately leads to long-term poor health outcomes, that the stress of racism takes a psychological toll on Black Americans. These things can't be denied as we're looking at the disparities that we have within the framework of our society. And so the only way for us to be able to address it, not only is to own it, but then to be able to call it out as we see it, and then to attack it as it is. We're understanding that addressing the issue of racism is as much a public health issue as anything else. And that every factor, it can't just mean we're just dancing around the outsides and saying we want to move to an area where we're not looking at race. The problem is society wasn't baked and built that way. So we have to actually be proactive in a way of actually being able to attack racism as a precursor to the way you're attacking all these other issues.
Pamela.
Yeah, let me just add one thing. So, all of those elements that Wes just outlined are all what we call the social determinants of health. And when you think about that, they are the root causes to why there are these healthcare disparities. And so, as I always talk about it, is right now, present day, we have just taken off all the bandages that have been applied over the years. And so now we're just gushing blood because we have not identified and addressed where we are bleeding from. Why are we bleeding? And so for some reason, it's really difficult for some to get their arms around the fact that we really have to focus in on education. We have to address the wealth gap. And so much of that is stemmed from so many years ago that right now, it's about how do we inject resources specifically where those gaps are. It is not about applying it across the board because that's having an equality strategy, but how do we have an equity strategy? How do we ensure that the resources are being deployed where there is the greatest need?
But even if we talk about that, I mean, if we say education is where we must do it, that's the reality, is that you're still going to come up against folks who say, wait a minute, why should our money go over there? It's our money. And so you have this whole issue of money and access and structural racism that exists in housing patterns, because schools are funded based upon neighborhoods. And so all of a sudden, when you start breaking all of these things down, you still go back into this whole piece. I use example Dr. King in Chaos on Community, where he said it didn't cost America much to allow us to go to be in swimming pools and parks, hotels. He said now the real cost is writing that bigger check, and that's where we've had this block. America has not wanted to write that check, and Americans have not wanted to say, okay, decades and decades and centuries of neglect. We're now all equal. That's sort of where we still are.
The point you bring up is a really important one. This idea that we have to be able to be honest about our history, right? Our history can't be understood without understanding the impacts of everything from redlining and the Homestead Act. If you don't understand the impacts of discriminatory lending policies, if you don't understand the impacts of this transition, everything from Reconstruction to Jim Crow to mass incarceration, if we don't understand that even when you're looking at health disparities, right? The fact that we have such massive health disparities within our communities right now, it's not because of accidental frameworks. And so with that, we have to say then, so when people say, do we need to invest in education? Absolutely. But the reality is that a college degree increases lifetime earnings by nearly $1 million. But the research also shows that Black college graduates on average earn less than white high school dropouts. That's data. And so for us to be able to unpack and unpackage this, it also means that we have to be able to have a distinct and a specific lens on this issue of systemic racism in order for us to be able to move the conversation to a place where the conversation needs to go. When people say that we want to move to a post-racial framework, the reality is that's not everybody's goal. We don't want to move to a post-racial framework. We want to move to a post-racist framework. And there is a difference. And so how we then approach and attack those specific issues with that as a distinct goal is then going to have a significant movement and significant barometer searching for everything from the way we look at health to the way we look at education to the way we look at housing and all these other factors that play into not just the life expectancy, but the quality of life for all people within our society.
Pamela, I think one of the fundamental issues here, when Les brought up the whole point about Reconstruction, I sit here and I think about W.B. Du Bois, Black Reconstruction, and then of course Eric Foner's book, Reconstruction as well. And the thing with when you start talking about this issue, you start talking about what is systemic, what is prolonged, and really what put us in this position. I think one of the greatest mistakes that happens in this country is that we simply don't want to go back far enough. And we want to say, look, can we just look at last week, or can we look at the last 5 years? But if you don't examine this in its totality, I don't think it fully prepares you for what you have to do to repair it.
Yeah, I totally agree, Roland. I was just reading a couple of days ago, I think it's Baltimore, they're going to redo their history books to make sure that they're inclusive so that students are really understanding, how our country was formed and why there are certain policies in place. So I think it starts there. That still is education. It's just that we don't tell an inclusive story. In addition to that, I thought about a lot of what you said last week about how we sometimes go all in around a national agenda, but we forget about the local and state agendas. And so how do we have more of our young people really start to get trained and embedded into policy efforts at a young age? Because it is about dismantling those policies and systems that are in place. Because quite frankly, I will be honest, growing up in rural America and being there over the past week, I still see those policies very vibrant in rural America. And then when you look at the poverty level, when you look at the health outcomes of those particular communities, it's infecting everyone except for a very small population. And so until those systems are addressed, but young people have to be educated in order to start to dismantle them. And quite frankly, it starts at a local level.
Wes, this idea of if you look at the Robin Hood concept, you look at social impact fund, do these actually work? And if so, how then do we understand them? How then do we replicate them?
Yeah. So they absolutely do work, because we cannot forget about the impact of the private sector, of philanthropy, of social service organizations and nonprofits, in helping to not just help to improve quality of life, but save lives. Some of the most people have to remember that the largest provider for all social services around the country is not the government. It's actually these nonprofit organizations and these social service provider, that even the ones that the government contracts with them, they're the ones actually doing the work. And so these organizations are actually making a significant impact, both being able to focus on these issues, but also being able to drive the conversation. I think about the work of Robin Hood, where in our history, we've allocated north of $3 billion into the poverty fight. Recently, we just launched a platform called the Power Fund, and the Power Fund is a fund that's exclusively focused on funding organizations led by people of color. A big reason for that was because over the past 2 decades, we've watched a 400% increase in philanthropic dollars going to organizations, and only 10% of all philanthropic dollars are going to organizations that are led by people of color. And you see how that mirrors itself even in the private sector, in VC and private equity. And so really the core focus of our work then is simply saying, how can we put that focus in saying that if the people who are closest to the challenge are closest to the solution, why are we not doing a better job of funding these organizations that are led by impacted populations, people of color, and the people who are closest to the solutions? And so philanthropy plays a really important role in this. It's also, though, important for philanthropy to remember and to be able to walk with a sense of humility. And walk with a sense of humility in the fact that the reason that we have philanthropic organizations in the first place is because there are holes that the government and our policies are leaving that people continue to fall through. You know, you mentioned our frat brother, you know, Dr. King. There's a quote of his that actually sits on my desk, and it says, "Philanthropy is commendable, but the philanthropists can never forget the economic injustice that makes philanthropy necessary." And so we have to be able to attack it from both frames where the private sector has a role, nonprofits has a role, philanthropy has a role, you know, the public sector's role, everybody has a role. The people have a role. However, that role is not to leave government and better policies off the hook, because we have to understand why we have a need for so many of these infrastructure pieces in place as well.
Oh, go ahead, bro.
No, go ahead. Go ahead.
Well, you know, that's why I was going to say it goes to accountability among all of those sectors. And so going back to that notion of a scorecard, how are we rating each one of those institutions around how they are contributing to this process? You know, one of the things that I will share is that, you know, the Heart Association as a nonprofit, one of the things that we recognized, and you know, we actually had a paper published, was around the social determinants of health. As a result of that, we were like, you know, how do we get invited to the table? So to Wes's point, instead of people coming to us, how do we go to the other tables? Because we have to learn from the community. And then how do we elevate those community-centered solutions, and then how do we invest in those? And so currently, you know, we do that through our social impact fund. We have a Bernard J. Tyson fund. We have our accelerator. Roland, you've been a part of that. So we incubate small social enterprises and funding those businesses that, quite frankly, they would never, ever get large amounts of funding. But the other thing that I will talk about regarding that is that may be a small step in the entire ecosystem, but as a result of that, what happens afterwards? And that's the part of being a catalyst that I think is so important, because they come through an institution like an American Heart Association, they're then able to better tell their story from an outcomes perspective and then get additional capital. And so those little dollars actually end up with more dollars just from the standpoint of coming through a small incubator like ourselves or being funded through our impact fund.
One of the points you made there, Wes, is important, that when we're having this very conversation, I think we have to be in a constant state of challenging, as you said, philanthropy as well as corporate America, private enterprise, to look at this as an investment in the future as opposed to change. Because I think, again, and I made this point last week, that one of the greatest mistakes that we make is when we look at the continent of Africa. Do we look at that as investment? Do we look at that as aid? And I think constantly reminding folks of that is important, because then that dictates how the person across the table perceives their input and the value that they bring to the table. If we look at this as, well, we're aiding a group of people, then it's then treated as charity. But as opposed to, if we're making an investment in ending this, you're really making an investment in improving the nation and its future.
And I think it also goes back to both reframing how we talk about what does it mean to make an investment, and also what does it mean to provide a return, right? I think both have to be evaluated, because when people think about return, oftentimes when people think of investment, it's because I'm expecting a return on something, right? So I make an investment, I'm expecting a 5% return, a 10% return, a 15% return, whatever it is, but there's a monetary focus of it. But when we're talking about what does it mean to be able to provide a return on our society and return on our community, we have to be clear that this is not just a feel-good thing. We have to be clear about there are economic costs to racism. There are economic costs to disparities. There are economic costs to the fact that it's not just about the impacted population, it's actually impacting all of us. For the fact that we have people and individuals and children who will never fulfill their God given and their God desired ambitions, simply because of the frameworks of the society that we've asked them to exist in. And so I think part of this, it really does go back to, are we talking about this as if it is some form of a feel good? And it's not. Are we talking about this as if this is some form of a, it's a nice to do, or we're rallying to the moment? When I talk about work like the Power Fund that we do at Robinhood, people say, it's great that you all push this initiative in the era of George Floyd. I said, let's be clear. What we're seeing and the disparities that we're seeing existed long before 2020 or the quote unquote racial reckoning that this country is having. And we did not build this because it's a nice thing to do, or we wanted something to put in our annual report. We built it because we actually care about solving the problem. And it's a very clear thesis, and I'm willing to make a punt all day long, that if you care about solving the challenges that we are trying to solve, then it is impossible to do so if you do not have more people of color, if you do not have more impacted populations, if you don't have more Black folks that are sitting in positions of authority to be able to help to understand how the people who are closest to the challenge are closest to the solution. You take this issue of child poverty, for example, and this goes back to your point, Roland. Child poverty costs this country every single year anywhere between $800 billion and $1.1 trillion a year. That's what it costs this country. Child poverty. Children who are growing up in deep states of poverty. So to say that investments in child poverty, investments in child health, investments in moving children out of deep poverty, that somehow we're doing it to feel good, that's not a feel good measure. It actually would significantly increase the GDP of our nation. When you look at Morgan Stanley releasing reports saying that systemic racism has cost this country $16 trillion, we address this not because it feels good. It's because it's actually having a market impact on our economic viability. And so I think we have to reframe not just how we think about investments, but we also have to reframe how we think about returns.
Pamela, someone asked this question here, and I think it's apropos for you. The question is, what does this have to do with the American Heart Association? Why is the American Heart Association focusing on this, emphasizing this?
Well, it's everything that Wes just said. It is the impact on the livelihood of people. And so when you think about having equitable health for all, that is the focus for our organization and what we're driving to for 2024. It is about improving the health of all, but to ensure that people can be able to thrive. And so when you think about the gap of those that are being impacted because of the social determinants of health, because of lack of quality care, lack of quality food, those numbers are increasing. And so all that means is that more and more people being ill, people are dying earlier. When you think about that, take the city of Chicago. When you think about that, there is a 30-year lifespan gap just between two different zip codes. We should all be outraged by that, but we're not. And that means that it's not about do we care, it's whether or not do we want to invest in addressing where those gaps are. So that's why the Heart Association is so committed, and why we actually announced the fact that structural racism is a risk factor for poor health. And so we have to address the fact, and we have to acknowledge it in order for us to try to make strides. And I do think that it's important for partners to come together to be able to say that this is where we have an opportunity to address what has impacted so many in a disproportionate way, and also recognize the financial impact that it has on all of us because people are not healthy. And
I can say, I think, first, amen to everything everything that Pamela just said. But also, if people can say, well, why, you run an economic mobility organization, you run a poverty organization, why does this matter to you? It matters because healthcare is a human right. That's why we have long supported health programs for low income, marginalized individuals, including everything from, medical care for homeless individuals to robust support systems for expecting mothers. The fact that an equitable public health system has positive ripple implications for our economy when you consider healthcare expenditures, like we were talking before. I mean, severe maternal morbidity costs New York City alone, around $17 million. And so you can't address any of these issues if you also don't have a clear lane of understanding what we are doing to understand that the cost is not only a burden in accessing healthcare, that's societal. It's social capital. It's all these other factors that the American Heart Association is really focusing on and drilling in on, and in a very powerful way that's having true ripple effects on the larger aspects of our society.
The folks, if there are any questions from the live stream, Facebook and YouTube, pop it up, put it out there, then I'll actually read that question. Measurement. Wes, I'll ask that. How do we stay vigilant in measuring progress so we know where we are 6 months and then a year and then 2 years, and what should that look like, and how and what should be the updates be?
Yeah, it's a great question, and to be clear, I'm a very, very data driven leader, and I run a very data driven organization. Robinhood first started 32 years ago. It was really started by a group of people in finance, and part of the argument that they were making was that we use measurements for everything that we do when it comes to our work. So why would we not use the same thing when it comes to our philanthropy? And it is important because I believe deeply on this idea that what matters gets measured, and what gets measured matters. You can be very clear as to what's important to you by just simply showing me what measurements you're looking at, because that also gives us a sense as to where should we be 3 months from now, where should we be 3 years from now, what adjustments do we need to make in order for us to achieve our long-term goals. Now, I do believe, though, that we cannot we need to make sure that the data and the measurements that we are using are ones that are reflective of a community, that they're reflective of the kind of goals that we're looking to espouse and the values that we're looking to stand by. That it's not just about putting together data for data's sake, but it's about really coming up with core ideas to make sure that all of our capital is being utilized in the smartest way, and that the community that we are working with and serving is feeling the distinct direct benefits of that level of diligence. Both of those two things can happen simultaneously, and I believe they have to happen simultaneously in order for our work to be effective.
I totally agree with that. And Roland, if I can just add there, I want to give an example because, there was a donor that wanted to do good, and he wanted to put a grocery store in this underinvested community. And he did, but no one ever came to the grocery store. And he was like, why did it not work? He didn't understand. But the reason why it didn't work and people didn't frequent there is because he didn't have the support of the community. Now you flip that around, and then you think about another gentleman that was from the community. He worked with the community, and he built a grocery store. And he was actually able to replicate that grocery store to 4 different locations, but he built it with the community. They were at the forefront of it. He employed those from the community, and he allowed for them to have resources within that grocery store. So he put a federally qualified health center that was in that grocery store. He actually had healthy teaching classes. So there was also a bank. So when you have things that the community says that they want in an environment, so you build it in that way, they will help to support it. And so there are many examples of that. And I think that we have to think about how do we scale those, because resources are very limited. And I constantly say that what you're trying to do has already been done. So just take what's been done and then elevate it or tweak it for your particular community. And we see that quite a bit, just from, the seat that I sit in and being able to look across the country. And I really want to see us be able to mitigate that, scale the solutions that are working, that have the outcomes that to support that both financially and both from an impact standpoint, because we are a data-driven organization. So it has to be grounded in those outcomes. So how do we elevate those and across the country if we see that a model is working?
Question here, and that is, do we reinvest in HBCUs in our neighborhood?
Well, I will speak to that. And I'll just say that, well, I am very proud that the American Heart Association has, we have always worked in alignment with HBCUs. It's normally been on a local level, but the one thing that what we are really proud of is that we've been able to elevate that strategy to make it a national platform. And how do we do that? We invest in young people that are going into the healthcare sector. We provide them scholarships. We follow them on their journey. We provide them opportunities to be mentored by some of the leading scientists, researchers in this country. And so just that exposure makes a huge difference. We released a film about diversifying the pipeline into medicine. We worked with all of the HBCU medical schools for that. You can check that out online on empoweredtoserve.org. And it's actually been a catalyst for being able to elevate the conversation to say, we need more healthcare professionals that represent the communities that they serve.
All right, let's see. Let's see here. Wes, someone says any solution property has to have a holistic approach. Our health is critical. We can have the best financial solution, but we don't have healthy people to implement them. Nothing happens. And so the question, so with that, as we approach the end of our process here, what exactly? How do we also emphasize that? Because we have African Americans who are of means economically, yet still have health issues. So how do we grapple with that?
Yeah. It's it means that we have to be able to tackle the health issues within our community from literally from birth and prenatal until when we think about the health challenges that exist within our community, they are real, they are dire. And the disparities that we see on the health side are things that cannot just be explained away by simply saying, well, this is about if we can just influence or introduce more access to capital. It's bigger than that, and it's deeper than that. And I think about the role that that we've played with the organizations that we've supported. For example, we've supported the Nurse Family Partnership, where we've invested in visiting nurse service for New York's Nurse Family Partnership model, which provides about 2.5 years of home visits by registered nurses to more than 850 first-time mothers, their children. It's been proven to reduce infant mortality, improve birth weight, improve a mother's physical and mental health. I think about the work that we've done around supporting Montefiore Family's Resiliency Program, which is a hospital system in the Bronx. It provides $2,000 of cash assistance to low-income families who've lost their primary breadwinner due to COVID-19. These are things that we have to understand, that there's not a single thing we are going to invest in that's going to solve the challenge of health disparities, because we also understand health disparities don't show themselves that way. It's not like it's one thing. We have a continuum of oppressive inequalities that exists within the lifespan of our families and our communities. And so therefore, I couldn't agree more with the question that health has to be at the forefront of these issues of addressing this, but also there is never going to be one element of that conversation that we think alone is going to solve this, simply because every single one of these issues weighs on another one. And every single one of these issues, it becomes a prerequisite for solving all of the others. That's the holistic nature in the way that we have to look at improving the health conditions of our community.
The as we talk about, look, there's a question here, Pamela. It says heart disease affects 48% of Black women, 46% of Black men. What is being done to raise awareness of this crisis in terms of heart health literacy within the Black community in particular? Here's one of the things that comes up. This is one of these things, Pamela, that people ask: where do you start? Is there one place you start first? It's like, and I think the struggle, to be honest, for a lot of people, is trying to figure out, where do you begin? And are there examples of where we have seen a drop in certain categories based upon this type of work, based upon putting the work in and the follow-up? And so what examples can we give folks to say, no, this is actually happening and we're making positive gains, but trust us, stick with it?
So I'm going to give you two examples real quick. First, I want to give the example of, yesterday we just got the data back for a faith-based program that we ran for 6 months. And so and it was focused specifically on African Americans and African American women. And so when you saw that there was a 10+ increase in not just awareness, but then also taking action, you don't usually see that type of shift. You just don't. Usually it's incremental, maybe 2 or 3%. So to see a 10+ increase, it said to us that this type of structure where there is a key community leader leading people on how to address the risk factors for better health, because most of the risk factors cross between heart disease and for cancer and everything else, that it gives us an indication that that model works. But then you bring it to, how do you scale those types of strategies? And then I will just say that there's one particular organization that has proven out the model that if you are purposeful in building a community, you will have positive impact. And so there's one area in Atlanta that they were very focused on how they could not only improve having better schools, the types of teachers, having a walkable community, having grocery stores, also having a healthcare center with both primary and specialty care. What they have been able to see is a drop in heart disease and stroke. They've also been able to see a higher percentage of students that go on to college. So as Wes just described, because it's multifaceted, it can't just be the one thing, because you just can't solve for having high blood pressure or diabetes. You have to solve for these other systemic issues, because when you do, all of those numbers, you will see them go down. And so we have seen that. And I believe that if you do it, if you are able to apply that type of strategy, then we can scale and have a more transformative impact.
And that word scale is so vital. The reality is the only way you're going to really have mass impact is if all these different initiatives that you do reach scale.
And that takes resources. But one thing, Roland, that you mentioned last week that I think that we all really need to think about is, what is that 3 to 5 point plan that most organizations can get behind? We got AKAs, the alphas, the links, Jack and Jill, that spans the lifespan, right, for our community. So how do we all get in alignment around that? And then we as a collective We're the ones as a collective going and asking for those resources to be put around those 3 to 5 point plan and focus there. Because if not, we just have a scattered approach and there's just no scale. And those programmings that are being done that, they're great programs in a silo. But when you think about the greater opportunity where wealth can be created, we have a more educated society. Those two areas, those two critical areas can be so much more impactful, but we all have to be aligned with that same goal in mind, working in concert and rowing in the same direction.
Wes, speak to that again, scale, how critical scale is to take something from a pilot program and then take it to 1 community, 5 communities, 10 communities, multiple cities, to really see the kind of change needed.
Yeah, I mean, I think there isn't a single investment that should be made if scale is not also part of the goal. What is it about this that is either going to provide the oxygen, as Pam was saying, provide the oxygen for this thing to grow and scale and to serve more people? Or is it something where this is going to change the design or a narrative that we can actually create a policy change around it? But one of those two things has to be in place because we're never going to philanthropy our way out of these challenges. There isn't enough philanthropy in the world right now. So currently, if you take a look at it this way, there is about $700 billion, more or less, that goes every year into philanthropy, right? And people say that's a lot of money, $700 billion. It's a lot of money. Now understand this, of that 700 billion, half of that goes to colleges and universities. Okay, so now we're not talking about 700, now you're talking about 350. So people say 350 billion, that's still a lot of money. Okay, fair. Half of that goes to homes of worship and hospitals. Okay, now you're down to 175. For everything else, for poverty, for housing, for veterans, for seniors, for the environment, for the Heart Association, everything else then falls into that pie of what's left over. So we're never going to grant make our way out of these challenges. I think about, so for example, one thing that our organization, funded before, where, we were the first organization, one of the first organizations to fund needle exchanges. And we funded needle exchanges when that was a really controversial thing. It was like, people were like, what do you mean you're going to give clean needles to people who are using drugs? And we're like, well, the data is showing that if you're looking at the rise of HIV/AIDS in the 1980s, a lot of it was because of the transmission of dirty needles. And so we're not sitting there making a judgment as to people's behavior. But what we are saying is, if you continue transmitting dirty needles, you will continue to have a spike in HIV/AIDS. And so we said, listen, we know it's controversial, but we'll fund it. Now, we don't fund it anymore. Nobody does. The reason is because the federal government funds it. But the federal government was never going to be first money in. The federal government needed philanthropy in order to essentially be risk capital. And that becomes a unique role that philanthropy and the private sector, et cetera, can play in this, where you can be a unique level of risk capital, where the biggest question that you're trying to answer is, tell me about the problem you're trying to solve. Tell me about the issue that you're trying to take down, and then tell me about the barriers that are standing in the way of you being able to solve them. Oftentimes, you will see that the initial conversation is about capital, right? If we can just get capital, we can do X, Y, or Z. But when you really drill down, when people are talking about what's the issue you're trying to solve, it's a structural issue. It's a policy issue. It's if we can get X overturned, this would not be an issue anymore. Or if we could get Congress to pass X or my state legislature to do Y, this would no longer be an issue. So that issue of scale has got to be something that has to be part of that conversation on the initial.
Well, Wes, I think that's because part of the problem is that what you have, and this is the point of not trying to be political, but it is political, because whenever you use the word policy, the root word of that word
it's politics.
It's politics. The problem that you have is you have one political ideology that says less government, personal responsibility, private sector, let philanthropy handle it. But you just broke down the numbers. Then you have another ideology that says no, government serves a role to help the people in a multitude of areas. I'm thinking, as you were talking, I was thinking back to this back and forth that billionaire Mark Cuban had on last week, when he suggested people, as opposed to give political donations to the candidates running in Georgia, to give to food banks. And then someone jumped in by saying, okay, we support food banks, but how about if we actually had a real food policy initiative coming out of the federal government with the SNAP program? Then you wouldn't have to be relying on money going to food banks.
Yes. Yes.
And people were like, oh my goodness, not really understanding that for all of the money you can give to a food bank, actually, you literally have an initiative that costs you virtually nothing. Well, not to say virtually nothing, but the amount of dollars to actually feed people in the most food prosperous country in the world. That's really where you should be saying, isn't that their job?
There's a danger, a very real danger, that has been going on for really since, for decades, on this idea of this mistrust of government, and this mistrust of anything having to do with government, that your money is just simply being wasted, that it's inefficient, without understanding that the functional and the fundamental role of government is to serve as a platform of support for the people who are within its jurisdictions. When I read that article back and forth on Twitter, and was amused by it, because you're absolutely right. Do we want people to be able to support their food banks? Absolutely. We are watching a food insecurity crisis that's taking place right in front of our eyes. We're watching a situation where 1 in 4 parents are literally skipping meals. 1 in 4 parents are skipping meals so their children don't have to. We have watched 11 years of job growth go away in 11 weeks. We have watched this level of housing and food insecurity we have seen levels that we have not seen within 3 generations, where we are on the verge of now watching a housing court crisis that will be the largest housing court crisis in the history of this country. So the idea that the way we're going to solve that is asking people to just give to their food bank is not only is it naive, it's uninformed. We have to understand that we have, for example, a CARES Act, which is, for example, been the last piece of significant legislation that's been passed to be able to support the most vulnerable families in our all families, but specifically the most vulnerable families within our society, which, by the way, left out millions of the most vulnerable. Because if you look at the CARES Act, for example, the CARES Act left out, particularly that cash assistance measure. That cash assistance measure left out anyone who was undocumented, even if they were working and paying taxes. You know what it also left out? People who are in mixed status households. You know what it also left out? Students. You know what it also left out? People who were working but not making enough money to hit the income filing threshold. So we're not talking about something where just where the support for your local organizations, which is incredibly important, and I hope everyone makes that as part of their personal involvement and pledge. But that alone is not going to dilute the impact that government has to have when it comes to creating policies that are in the better interests and in the best interests of all of its citizens. Because the thing is, when we have these conversations about who are policies better benefiting, one thing we know is that there's certain groups that are consistently benefiting from every single bill that's passed and every single policy that's enacted. And there's certain groups that are consistently left out. So that's the dynamic that we need to change when we talk about what is the role of government, or is government too big, or things along those lines. This fundamental mistrust that we have of anything that deals with government is not just incredibly dangerous. It's also been incredibly intentional, and we need to understand that too.
Pamela, final word.
The final word is the following, and I'm going to quote Benjamin Franklin, and he says, "Justice will not be served until those who are unaffected are as outraged as those who are. And I think that that is where we are right now. We have to be outraged as the American people that we have got to address the issues that are making more and more of us sick, because it's going to impact all of us.
All right, then. Well, folks, last Tuesday, the American Heart Association released a presidential advisory declaring structural racism as a nationwide public health crisis and a major cause of premature death. As we close today, we certainly want to hear from each of you. What do you see as the best opportunity for dismantling structural racism so that African Americans have an optimal and just opportunity to be healthy? So that, of course, is one of the things there. And so if you could just speak to that, Wes, and it will be our final question and answer.
Yeah, so I'm sorry, Pamela. I was saying, so yeah, I mean, I just want to, just first kind of leave my final word, which is saying thank you to Pamela and thank you to the American Heart Association for your work. I think in a time right now where we have so much going on and there's a lot of noise going on about how people should be thinking about this time and how people should be prioritizing. And frankly, it's a very scary time for a lot of families. It's a very scary time for a lot of communities. We've watched a lot of, the basic, fabrics and tethers of security that people have felt have been evaporated, and overnight for many families. So the ability for people to know that your health, your sustainable, long-term health, that it matters, and also our voice and our advocacy in this time matters as well, is crucial. So again, I not just applaud the work that you're doing today and every day. I want to let you know that we are here to help and support you in that work, however we can.
And Roland, I just wanted to say thank you to you and to Wes for uplifting these critical topics that are impacting our community, from advocacy to quality to leadership, what we do inside of our own institutions, because it's all grounded in science. And so I just wanted to say thank you on behalf of the American Heart Association. And I know it's a little early for you, Roland. And I know that both you and Wes have really busy schedules, but we are very appreciative and lending you your voice around these critical issues. Thank you.
Yes, me being the night owl. Well, we certainly appreciate it. Thank you so very much. Final comment for the folks is very simple, and that is the work can't be done unless you actually do the work. That for a lot of people, people always say, well, who's going to do it? Who's going to be in charge? Who's leading it? Well, the reality is everybody has a role to play. The question is you have to simply decide what is going to be your role that you play. Not everyone can do what Wes is doing, but Wes can't do what he's doing unless he has folks who are working with him. Same thing with the American Heart Association. They can't do what they do solely with their staff. It also requires the supporters and volunteers. And so only you can decide what role you want to play in making sure that we confront the reality of structural racism as a national public health crisis. For Roland Martin Unfiltered, all my staff, we certainly appreciate it. Thank you so very much. And folks, y'all have an absolutely fabulous day.